Good morning to all. Now about the global data about COVID-19. This I am skipping because we know that the SARS coronavirus 2 comes under the coronavirus family. This I am skipping. You have already been covered. So how the virus originated, more or less all know, but to recapitulate, in December 2019, in Wuhan, Hubei province, China became the center of an outbreak of pneumonia of unknown cause. And all the cases shared history of exposure to the Huanan seafood market, where various kinds of wild animals were on sale, including poultry, bats, and marmots. And the wet and dirty environment provides favorable conditions for the virus to survive and reproduce. In 31st December 2019, the local health authorities of Huanan, they issued an epidemiological alert and market was shut down on 1st January 2020. 59 suspected cases of pneumonia were transferred to a designated hospital starting from 31st December 2019. And on 2nd January 2020, 41 admitted patients were identified as a laboratory confirmed case of novel coronavirus using real-time PCR and next generation sequencing. So the 31st December 2019, Wuhan notes 27 pneumonia cases. To 8 December 2019, 8 January, China Center of Control and Prevention announces a novel coronavirus isolated from the Wuhan pneumonia patient. 10 January, first genome was released by the China in Gene Bank. 30th January, WHO declares it a public health emergency of international concern. On 11th February 2020, WHO names the disease as COVID-19 and the virus was named as SARS coronavirus 2. And on 11 March 2020, WHO declares COVID-19 as a pandemic. So since then, what happened to China cases? The maximum number, we can see that the maximum explosive number of cases were seen during the January and February. After that, all the cases in China has decreased, and now only handful of cases, 2 to 3 cases per day can be seen from the China. But now, on yesterday, the top 10 countries reporting the new coronavirus cases. First is US, United States of America. Second, India, Brazil, Russian Federation, Colombia, Argentina, Spain, Peru, Mexico, and France. Among the but total cumulative cases is highest in United States, but number of new cases reported in last 24 hours, maximum number of cases were reported from India. Although the cases are decreasing in India, still we are reporting highest number of cases, new cases per day, followed by US, Brazil, Russian Federation, Colombia, and other countries. All other countries are in phase of community transmission except India, where it is still no community transmission, and Russian Federation also. And total, the number of cases are nearing 4 crore cases, and last 24 hours, 3 lakh cases has been reported in global, and total cumulative deaths are more than 1 million deaths, and last 24 hours, 4,000 deaths has been reported. Among the active cases, we can see that there are around 8 million active cases are there. Among them, 99% were in mild condition and 1% in serious or critical condition. And among the closed cases, 96% recovered, discharged, and the deaths were 4%. So we can say that the case fatality rate is around 4%. Now, when we speak about the different case fatality rate, Mexico has the highest number of case fatality rate, around 10%, followed by Ecuador, UK, Iran, France. US has a case fatality rate of around 2.5%, and India is among the lowest rate of case fatality rate of around 1.5%. So we have very low case fatality rate. Now to detect among different number of rising of cases and the number of deaths, we can see that the number of cases are still rising. in the different WHO regions. And but mainly the cases are mainly rising in the Americas and the Asia. And in Europe, we can see a double peak. Firstly, in March to April, there was a slight increase number of cases, but the cases decreased in July. But again, the European countries, they are reporting increased number of cases. In Southeast Asia, the number of cases are slightly decreasing. We can see that the death rate rose sharply around April, May, but it has fallen down now, and now it is decreasing and mainly it is stable now. This is about the total cumulative cases, but what about the cases per million cases? We can see that the cases per million, maximum number of cases per million person can be seen in Europe, South America, Russia and US. We have an intermediate in India. We can see that an intermediate level of cases per million, around 101 to 500. We are in intermediate positivity rate. So in last week, we can see that the cases, new cases has been rising around 10%. But the truth is that the number of deaths is decreasing. That's 1% is decreasing. Death rate is there. And among the Southeast Asia, including India, the death rate is decreasing. In America cases, we can see that the number of cases were highest during the July-August, but it has come down in September. Also, that death rate has come down in America. In Europe region, we can see clearly two double peaks. In March, April, you can see one peak of cases. And now, another peak has been occurring in Europe, Eastern European countries. In this, we can see the number of cases are increasing, but the death rate has been very less. In the second wave of the pandemic, in Europe, the death rate has been very less. So we must not complacent in the scenario that the cases are decreasing, because we in this lockdown, and if we relax in these cases, we can see a second also in India also, like in Europe. मूव नहीं कर रहे. In Southeast Asia, including India, we can see that the cases are have increased up to the September month, but from the middle of the September, the cases are decreasing in Southeast Asia, including India. Also, the number of deaths are also decreasing. That is a positive sign in Southeast Asia, including India. In Southeast Asia, mainly three countries that have the maximum number of cases are India, Bangladesh, and Indonesia. And all other countries in Asia are reporting very few cases, except Nepal, where the cases are increasing. In Africa also, we can see that a double peak. There are increasing number of cases during the July, and since then the number of cases has been decreased up to September. But again, there is slight increase in the number of cases and deaths in recent October. One thing the WHO has published is that what is the mortality rate and what is the number of cases among the healthcare workers. We can see that in March and April, May, the number of cases in healthcare workers were very high, around 25%. 20 to 25% were in April, May. The number of cases among them, the 25% were healthcare workers. But the good news is that since May, the number of positivity among the workers are decreasing. In July, August, we can see that the number of positivity in healthcare workers has been decreased. So overall, the WHO has reported that around 14 to 15% of all positive cases were healthcare workers. Now there is some epidemiological difference between the patients of healthcare workers and other general population. In general population, we see that males are more affected than females, and the slightly older population are affected. But among the healthcare workers, it has been reported that females are affected more than male, because the WHO has reported that in healthcare more maximum females are working. The number of female workers are more in healthcare workers. So proportionately, the females are affected more than males, and relatively the younger healthcare workers were younger than the general population. Those who were affected were younger than the general population. So last slide is the among the community transmission and cluster of cases. We can see that the all the maximum countries are in community transmission, like in European countries and American countries, but in India it is still cluster of cases. But the number of cases, case load is high, but still we are in the we are not in the community transmission page. So to summarize, we can say that the number of cases are increasing in all over the world, but the rate of increasing is less, and especially in Southeast Asia, including India, the number of cases are decreasing, and the mortality rate is also decreasing in India. So we hope that this trend can continue and continue for the future. Thank you.